is in the house. How you doing, Lori?
Pretty good. How are you?
I haven't seen you for a while.
Yeah, it was like December we talked about.
Has it been that long?
I think so.
Wow, 5 months.
Yeah, we talked about New Year's resolutions and
yeah, that's right.
Healthy.
That's right.
Healthy New Year's resolutions. Anyway.
First things first. I think you have an event coming up that you wanted to announce.
We do have an event. It's our first diabetes. It's a little mini expo and a dinner presentation. It's going to be May 22nd at Martini's Restaurant. It's where the old Ashtabula Country Club used to be on Lake Road. It'll be 4:30 to 5:30 will be vendors and exhibitors, and then dinner will be 5:30 to 6:30. It's prepaid. Dinner, you get your choice of 2 meats or a vegetarian dish. Call our RSVP line at 997-6555 with your name and a phone number, and they'll call you back to confirm the reservation for you.
That is May 22nd?
May 22nd, it's Tuesday. Thought we'd try an evening venue. And
Sure. Is there a price on that? Or?
Yes, it's $20 a dinner for each person. We'll have a little bit of an insurance tips and healthy eating strategies and questions answers session.
To kind of tie into what we just got done with Sherman Wursler regarding heart attacks, you mentioned just before you sat down is that there's a difference for diabetes patients.
Yeah, if you've had diabetes for a long time, you may not get those classic symptoms. It may be more those subtle jaw ache, toothache kind of thing, or just that more tired, more short of breath. It might not be that classic TV crushing chest pain down the arm and out. So it's one of those things always stay watchful for, because it's one of those things that you kind of say, oh, I'm getting older, I'm just getting tired.
Right.
And
that's
it
not
can
the
be
case.
that, right? And we have a program, since we're a chest pain center at ACMC, that if the pain doesn't go away in 5 minutes, it's probably time to call 911.
Okay.
If
that's a good rule there. 5 minutes.
You give that indigestion 5 minutes to go away, and maybe it's time to get it checked out.
Okay. Now, what we're going to talk about is, I just had that in front of me now. I forgot what it was. So what the subject matter is.
Oh, I thought we could talk about healthy, safe, being active. We kind of, maybe that was your New Year's resolution, and of course at that time we had snow and ice, and maybe by now when we had the nice weather a week or so ago, you went, I'm going to do it now. So there's just some safety tips to know. If you've got neuropathy, that's that nerve damage that happens with diabetes, you're not going to want to do your whole entire walk in 30 minutes, period. You may only be on 5 or 10 minutes at a time, and it's okay. A lot of times people are that all or none. I've got to clean the whole garage today, right now, and be disappointed if you can't do it all or you don't have the energy. With activity, you want to start slow and build it up slow, so you kind of go 5 minutes, 10 minutes. If you've got feet problems, neuropathy problems, talk with your doctor, because there are restrictions. Sometimes you need special shoes or special lifts. But just because you have diabetes, if you've never had a foot problem, you won't necessarily qualify for the free diabetes shoes. That's an insurance tip kind of thing. The companies are really good to say, oh, hey, you have diabetes, you can get the specialty shoe. It's if you had neuropathy or a previous wound, you've got to have 2 or 3 other issues besides diabetes for insurance to cover those special shoes.
When you're walking, like you say, 5 to 10 minutes at the max, probably. So you're probably referring to going back and forth on the driveway or something? You
could start with the driveway. You could start in your house. Maybe when you feel strong enough, you could go at the store with the shopping cart. Try to do 1 or 2 rows before you do the stop and shop. Just kind of see how far you can go. You want to make sure you got a good shoe on board. My premier passes on my shoe. Something with a solid sole. Your shoes have got to fit good. They don't have to be expensive, but they can't rub. When we're younger, we kind of said, oh, once we break them in, they'll be okay. With diabetes, breaking in your shoe means foot breakdown, means a wound that may not heal. Put you out of the game for walking once you get your stamina up to do a little bit more. But you want a shoe that fits good, has good padding and support. If you're kind of sitting there going, hey, this shoe kind of okay, I'll break it in, try the next shoe right beside it. Because a lot of times with our shoes, they're both 7s, but this 7 on the right side box fits a little bit better than the 7 in the left side box. You know, so it's always just, you want something that's going to protect your feet. It's flip-flop season too soon. A shoe or a stick, you know, with neuropathy, you could step on things and never feel that it's in there till you take your shoe off. The other thing you want to do is always take the shoes off 10 or 15 minutes into a workout and look at your feet. Make sure there's no blister starting, no redness, that the sock didn't get wrinkled up, because even though you can feel it today, 6 months from now you may not. A year from now you may not feel that.
You go to Premier?
I try to.
My wife started there a couple weeks ago.
Uh-huh.
She won a pass for a year.
Oh, did she?
Yeah.
Wonderful.
To work or something, and
yeah.
So she's been going, and she's actually seen some results from it. You know, but what was funny is she was doing some yard work the other day, and she goes, "I don't hurt from Premier Fitness, but I'm hurting doing this yard work." But you know, that's part. I mean, you're doing different things when you're doing yard work, up and down.
But her hurting probably didn't start as soon as it would have without the working out.
Yeah.
You know, the hardest thing with exercise is niching out where you're going to do it every single day, or
And
most
getting
days
started.
of it. And getting started, right?
That's number one.
There's the, I think this is good for me. Oh, every news article you're picking up this time of year is saying it's so great for you. I am always harping, take a walk or march in place. You know, if you truly are not ready to walk to the mailbox and back, marching in place, just watching through the commercials will help. But it's niching out that time that says, this is my exercise time, and protect it.
And I was very happy that she did this, and I was kind of concerned that maybe she wouldn't stay with it. It's only been a couple of weeks, but she goes 3 times a week, and she looks forward to it. Now I'm hoping that wall, it doesn't hit a wall and say, I don't want to do this anymore, you know. But like you say, if she has it regimented and she goes with a friend after work,
that's half the battle.
and that I think it helps.
Half the battle is having a friend, because you don't want to let down your buddy.
Yep, that's she has said that.
And being in the groups are small enough in most of the classes at Premier that you start to recognize, hey, they didn't show up, and when they show back up, it's like, hey, we missed you. Even if you don't exchange names or phone numbers or anything, it's still that there's a group of us together helping each other out. And the greatest news, and your wife's probably discovered it, they start you out where you are. You don't have to be the most fit person.
They coach you, right?
Yeah, they'll coach you. The classes I've gone to, the instructors are always, you know, if you're new to this, do it this way. It might be easier. If you're having trouble doing it this way, do it that way. And over time, you gain that flexibility and that strength, and you still feel good, even if you couldn't keep up with everyone in the class. You know,
Should the diabetic person eat before they do an exercise program?
most times it's good to eat your meals as scheduled and maybe do the exercising afterwards. You know, you wouldn't want to be one of these, I grabbed a cup of coffee out the door and then I'm going to go work out for 2 hours and then have breakfast, which is really brunch or lunch by that point in time. Because if you're already working from empty, you're only going to get more empty, and it can change your blood sugars, or you could get low while you're working out. The other challenge too is to know, how low will I go? You know, always take your meter with you. You might want to take a little bag, or gather a bag. My little bag's a little small, but you want to carry a quick sugar with you in case you're on the trail or on the treadmill and all of a sudden you're feeling a little low. If you can test your blood sugar, that's the best, to know how low are you, because how low you went, first off, tells you, hey, if I'm at 100 today and I'm going to be on the treadmill for 2 hours, I need a little more breakfast so that I don't bottom out on the treadmill. Or sometimes it's adjusting meds as your weight comes down and your exercise goes up. If it happens on a regular basis, we can change your medicines. But having a bag, some kind of bag that you carry a few quick sugars, you know, a couple of juices, always bring water, always bring something. Juice is the quick fix, that emergency. Oh wow, my body gobbled up all of my breakfast, extra good today, I need a quick fix. That's where you want to save juice. Quick fix, 15 or 30 grams of carbs depending on how low you went. 15 minutes later, if you need to do the next quick fix. This is just a quick fix. It's not going to get you home. So if you went for a walk at Lakeshore Park or Conneaut Park, you might need a little bit more to get you back to the car. So once you've done the quick fix, have something a little bit longer lasting.
This is after you're done, correct?
Well, this is if you got a low blood sugar. Doesn't matter if you're 10 minutes in and all of a sudden your blood sugar's under 70, you want one juice.
Can you
or
tell?
honey
Can you
packet.
tell that it's down? I mean,
Some people can. Some people have learned to ignore their body symptoms. So, I mean, usually with exercise, because it's a quick change, you know, you're coming down the steps and you miss that step, that sudden jarring drop. You'll get that shaky, sweaty, hungry. You're going to kind of notice that you're having trouble concentrating, or your coordination, you know, because when you're walking, you've got a set of coordination that's going on. You'll kind of go, hey, wait a minute, I'm feeling uncoordinated. Some people get like a numbness around their mouth. Some people just some people have learned to ignore that symptom though. So you've got to really know your body and know what's going on. And it's always best to test, because sometimes that shaky, hungry, tired isn't the blood sugar going down, it's shooting up because we had pancake breakfast with syrup and we thought, well, I'm going to go walk, so I'll just have extra pancakes, and it's going high. So that's why we say, if you can, take your meter with you so you know.
So what are the normal range numbers? Where should you be?
Hopefully you've discussed it with your doctor, because different people have different goals, but the national guidelines from the American Diabetes Association say that you could be considered healthy and safe at 70 to 130 before any meal, any time of the day.
Before a meal?
Before a meal. If you're peaking 2 hours after or at the peak of your meal, you'd want to be less than 180, and that's American Diabetes Association. You want to make a deal with your doctor to say, where is safe for me? Because it's very individualized. Endocrinologists kind of tend to say 70 to 110 before any meal, any time of the day, and no more than 140 at that 2 hour after.
Are the numbers any different between women and men?
No. General guidelines are about the same. The challenge comes with history. You know, if you've had some heart disease, if you've had the disease for a long time, or you get into those areas where you can get low and don't know it without testing. You know, some of it's retraining, but some of it is, some say, let's be happy at 150s. Some people are so used to being so unsafely high that the minute we bring you down even 50 points, it doesn't feel good. You know, that first time you get to a 150, if you've always been in the 200s, it's not going to feel good. But if we can leave you in those 150s and 200s and not have you bouncing out to the 3s and 4s, it'll feel better in a month. But it's hard to hold on for a month. Just like the exercise, if you don't start to see results or start to feel more energy in that first couple of weeks, a lot of people give up, and that's still where your body's building the muscle to enjoy the activity. Of course, then you hit that stalemate where you've met the match. You know, you've matched up the meals, the energy, the exercise, and at those times, that's when you check in with the trainer again or change up the program some.
I know many of the doctors that we've had on the show over the years has said that it's good to diet, but the exercise that goes along with it is what knocks those pounds down.
And the challenge is when you start to really match up calories, and there's lots of lovely information on the internet where you plug in your weight and the level you're doing, and it tells you how much running around with the kids, watching them all day, really spent in calories.
Yes.
And it's sometimes disheartening, because when you look at the calories in the meal you just ate, or what the drink is, or the celebrate, hey, I did the treadmill, let's go get a smoothie. It's kind of not an equal exchange.
She does that calorie thing on the internet.
Yeah.
I don't know what she's doing in there, but she's typing things in. It tells her how many calories she's had.
Yeah.
That sort of thing. So it's a good process that she's going through right now. I'm glad that she's doing it. One of the questions that we got in here to ask you, Lori, is hyperglycemia any kind of relation to diabetes?
Yes.
Is it?
Yeah. Sometimes it can be medicine induced, but there's a period of time now that's recognized, and like 10, 15 years ago we called it border. There's times where you run a little bit higher than the norm of 100. Now some people do safely run that slightly higher. I mean, they wouldn't be way out in the 150 or 200 land all the time. But there are some people that their normal is that slightly higher. And slightly, I mean, like instead of being 100 and under, they're like 100 to 124, 125. Once you get to 126, more than twice on fasting blood sugar, you have diabetes. Higher periods of sugar, you know, like you might be a perfect 80, eat your perfect breakfast, but your body spikes you up to the 180s, 200s for a while until your exercise and rest of your life, or your body catches up to bring that sugar down. That's the beginning. That's where we call it pre-diabetes. Now some medications we know, because breathing and moving come first, and one of the main drugs that we do for breathing and arthritis and pain can lead to diabetes. The way the drug works in our body, it will hike the blood sugars up. The body doesn't know that the blood sugar is higher because I'm under stress or I've had these meds. It's still doing the damage.
All right, so this hyperglycemia thing is low blood sugar. Is that low?
Hyper, the ER, hyper. Think of hyperactive kids, high blood sugar. Hypo, you're low, is the low blood sugars.
All right, say when a lot of times they say if you're hungry, a normal person that doesn't eat, I've heard this said, oh, my blood sugar is down or something because I'm so hungry or something. Does that sound right? It
might be, but the challenge is they're starting to realize that the prediabetes kicks in way sooner than we ever give it credit for. Now granted, if lunch was supposed to be at noon and you're outdoors picking up the sticks from all the wonderful wind damage and getting ready to mow the lawn again, which it's April and we're mowing the lawn already, you could be low because a lot of people are way away from the house and they're like, I've only got 25 more feet of the yard to clean, I'm not going back in the house yet. You could go low from not having enough to supply the day. You know,
pre-diabetes, does that mean you're going to get diabetes, or can you prevent that from happening?
It's kind of the prevent. The fun part with pre-diabetes now is the studies are starting to show that half of the people will develop type 2, half of them stay in that pre-diabetes. But pre-diabetes is that knock on the door that says, hey, sometimes my blood sugar is higher than it should be.
Kind of like a wake-up call.
Exactly. So if you want to kind of try to prevent diabetes, just kind of start living like you do have diabetes. And the good news is it's eating right, eating balanced. You know, if you wait too long because you're too busy to go in and take care of lunch when lunch is due, you come in starving. And the sad thing is when you're starving, you grab too much. Or you'll grab the junk that's handy while you're cooking the vegetables and the meat and the potato or whatever in the microwave. And then by the time you get to the good food,
that's so true.
Right. Or you were going to order the small appetizer meal eating out, and you're so hungry that it's almost like you get talked into that bigger meal. And then maybe I'll have dessert too because I'm just so hungry.
I want to talk about that, dining out for a person with diabetes. That's not an easy thing, really, unless you follow the rules very closely. Because you've told me you can basically eat anything as long as you don't eat too much of one thing. Like one slice of pizza, not 5, that sort of thing. So when you go out to dinner, to a restaurant, of course, a lot of menus today have they're health.
Some are very helpful. That restaurant industry is starting to do, give you that nutrition
for heart
information
and that sort of stuff.
Yeah.
But so, like when you go out, do you have to be very careful what you order?
I try to be careful when I'm ordering. I mean, even if you don't have diabetes or heart disease or cholesterol problems or blood pressure problems, we all should be careful when we're eating out. You got to remember that most eating out meals are 2 or 3 meals on that plate. So kind of ahead of time, ask for that take-home bag. Unless you're really good about saying, here's the third I'm eating now, or half, and I'm going to take that half for tomorrow. You can look for the baked, broiled, and grilled. Now granted, it's a restaurant, so you know darn well nobody wants to scrape it with Brillo afterwards, so it's oiled a little bit, but it's not like it's soaked in oil. So trying not to get the fried, trying to say dressings or sauces on the side, then you're in charge of how much goes in.
Right.
Do that with your baked potato sometime. It is amazing what they bring you out in butter and sour cream.
Large containers of it. Yep, you're exactly right.
And take the little bit for the bite you're going to actually eat. Because if you look at, someone that didn't ask for, or we know, they plop it both in there, they melt together, and then the bottom, of course, is dry.
Now, what you're saying, basically, instead of getting the fried shrimp, you get the broiled shrimp. Broil is good.
Broiled is good.
Baked.
But we're looking, 1/3 of our calories get to come from fat. So this is, if it's your one night of the treat, I'm the nurse. If it's treat night, this is my most favorite food in the world. It's my birthday or some special event. And you go overboard. At least own up to it.
So speaking of that treat night,
that
piece of birthday cake or that piece of pie is okay?
Yeah. Now, hopefully you didn't have the whole pizza and the pie, too. It's still choose where you're going to spend. your carbs, your calories. Choose as
How about
wisely as
How
possible.
about if you delete the pizza and have 2 pieces of birthday cake?
Probably one piece of well, it depends how, is it the corner with the rose on top?
Yeah.
That probably is the equal switch for pizza. But if it's the small centerpiece, you know, a 2-inch square of like a sheet cake, the cake by itself, since strawberry season's coming up, 2-inch square of cake's 15 grams of carbs. Cake's got a lot of fat in it though, which clogs up the arteries and the trans fats if you didn't make, well, it's got Crisco and, you know, that kind of stuff. Add that small layer of frosting on top, you've added 15 more grams of carbs. I love my cake, so you know what? If I know I'm getting a 2-inch square of cake, that little bit of frosting on top, I'm not going to have the dinner. I'm probably going to skip the potato too and double up on my veggies, have my meat, save it for my dessert. Not every day of the week, you know?
What's your thoughts on fat-free and sugar-free items?
Check the label. Check the label.
They still have a lot of calories in them.
And if you pull out fat, I mean, kind of think of if you used sand and gravel and salt to do the driveway, and you pull out the gravel, you've automatically upped everything else. But once in a while, when they offset it, you know, pick up the regular version of whatever it is you want, pick up the low fat, the low salt, the, you know, compare them side by side and see if it's truly worth the difference. Once in a while, it's only a couple of points off. Once in a while, it truly is worth the difference. You know, a little half cup of pudding, the sugar-free guy is only 15 grams of carbs. The half cup guy of the regular guy is 30. But still read the label, because my nice little teaching tool that I just used from when I read the label at the store, it's different. So, you know, when you've got the food labels, do side by side, because when you pull out fat, most of the times the carbs and the salt went up. And, you know, you're pulling out the fat for heart, but we don't need the blood pressure issue or the diabetes, you know, the hike in the sugar.
Good advice.
Sugar-free maybe is great, maybe isn't. That's another one of those. Compare the labels side by side. Because sugar-free maybe is only 1 gram of carb less, because you're looking for the total carbohydrates. You know, it's great, it tells you how much sugar or fiber, but it's the total, that serving size. And of course the labels are only for the serving size listed. So if it says a half a cup but you're eating the whole box, you look down at how many servings are in that container, and you multiply everything on that label by those servings if you're eating the whole box.
What about if you go, like you mentioned, strawberry season, what about fruits? Strawberries are very sweet. I mean, there's a lot of sugar in strawberries.
You get a cup and a quarter for about 15 grams of carbs. And that's before you add sugar, you know. The berries right out of the field when they're good.
Yeah.
You know.
Because you don't, like you go to a farmer's market, you don't have labels to, so you just have to know what you're...
Well, you can look in the stores. Most all of our stores in their vegetables and fruit sections have this lovely little book, or some of them have the tags right there at the fruit and vegetable. I love strawberries, so I know what strawberries are. Most of the reference books, if you go to the library or online, you type in strawberries, nutrition information, you'll find more information out about your food than you ever wanted to. A lot of the programs where you track in what you're eating and it will do the math for you. Say, hey, this is how many calories, how many fats, how many proteins, how many carbs. They'll tell you, you know, 1 cup of strawberries equal this much, or a half a cup of strawberries equal this much.
Okay. What about watermelon? Is that
a cup and a quarter for watermelon too?
Cup and a quarter.
For 15 grams of carbs.
Okay.
So this thing about eating as much food as you want is not really a good idea.
Not necessarily. I mean, truly in the sense of carb counting for diabetes, if you wanted 60 grapes to get to 60 grams of carbs, I have to say fine, you stopped at 60. But are you going to be full on 60 grapes? Because fruit by itself is just a sugar. It's low fat, it's low salt, it's a wonderful low calorie way instead of eating 60 grams worth of cake.
I don't know if I could eat 60 grapes.
Oh, there's at least 15 in one handful.
Yeah.
Really?
Yeah.
Grapes are one of those you
could.
sit there and go, grapes are like the bag of chips.
Well, then that ain't gonna do it.
You're like, I'll have one or
That's exactly
two,
right.
and you sit down with the bag thinking you only eat 1 or 2, and the next thing you look down in the bag, there's
Especially
a handful
the
left.
seedless ones.
Oh,
Hello. But then that's not going to keep me filled up.
Right, and the whole point with meals is having a balance and a variety. Every time you sit down to eat, you want something from all the food groups, as much as possible, in a balance.
And what about this drinking water before you eat to help with your appetite?
That helps some people out. You know, they say 8 ounces of water, maybe 2 glasses, you know, 8 ounce twice would be 16 ounces. Sometimes will help people feel full. or get filled up faster.
Right.
Also, starting with your vegetables and your proteins, because they have more fiber, so they take longer to chew. You know, if you've never experimented with that idea, try starting with the vegetable side of the plate first, the non-starchy vegetable side of the plate. Save that starchy side and the fruits more for the end of the meal, and see if that makes a difference.
Yeah.
Some people say grab that handful of nuts with those couple of water, because there's a hormone in the stomach, takes 30 minutes to wake up and say, hey, you're full.
Yeah. Now nuts are, they say, are good for you, but man, are they high in calories?
They're very high in calories because they're a fat. Every gram of fat is 9 calories. Yeah. So, I mean, there's the healthier fats, the monounsaturated that help keep the blood vessels nice and soft and flexible. There's the polys that are kind of the middle of the road. They're not as great as the monos, but they're not as hardening to the arteries as saturated. And then there's the saturated fats that, you know, harden up the plumbing. You know, they harden up the blood vessels. High blood sugar hardens up the blood vessels too. That's why it's have that balance. You know, and if you are like a once a day eater, your body sits in starvation mode all day long until you get to that one meal.
Yeah.
Right. I mean, if you're a once a day eater, let's try to split that meal into twos, because it's hard to learn to stop and eat.
What about this? Every people that diet, I know, say eat something every 2 to 3 hours. Are you a fan of that?
Some people that works wonderful for. Some people, it depends what you're grabbing as that snack, because what you're calling a snack might be a whole entire meal, and nobody needs 5 meals a day. So some people, it's great to eat something every 3 to 4 hours, and once again, it's got to be a vegetable, the protein, a starch. It has to be a complete idea. If it's only, you know, sometimes people will go, well, I'll eat the vegetable now, a couple hours later I'll eat the piece of meat, a couple hours later I'll have the starch. It's kind of like putting $1 of gas in the gas tank. You got to keep going back and going back, instead of having a little bit of all of it at one meal that can help carry you farther.
Pretty good advice.
There's a lot of good stuff that we hit on today that I really never thought about. Yes, just don't take it for granted.
So if you had one of those things, like those rice cake bars every 2-3 hours, that's not a good thing.
Not necessarily. How many are in here? These are, it says 1 carb exchange, so this one's about 15 grams of carbs. But, you know, it's cereal. So protein's going to be probably pretty low, less than 1 gram. Fiber, there's none. That's the other thing you want in granola bars, cereals, bread. You want fiber in it. You know, and the higher the fiber, unless they made the slice extra big, the better it is. You know, and now knowing that we're all watching for fiber, some places give you the slice that doesn't quite fit in the toaster, and it'll say 3 or 4 grams of fiber, and you're like, yay, found something with fiber. And it's 2 pieces of bread instead of 1. You know, you're counting it as 1 piece in your head without looking at that label. How many carbs? Oh, 17. So that's and 2 grams of fat. So if this is all you had.
All right?
Is that your breakfast?
Yeah,
Was that the
have
breakfast?
that for breakfast. Well,
you're missing
sometime.
a few carbs then.
Yeah, not all the time. I'll have wheat toaster once in a while too.
Yeah, well, the one thing you're missing, if it's just a bowl of cereal, just a piece of toast, there's no protein there. And it's real important to get that protein in.
Right.
You know.
Right.
The other thing to remember is if you're celebrating the fact you've just walked and mowed the lawn, don't cool off with a cold one without a meal with it, because alcohol can bottom you out. And not necessarily the minute that you're drinking it. It might bottom you out the next day on the treadmill at the gym, or a couple days later, depending on what's going on.
I had a thing I wanted to ask you, and it had something to do with what you just said. It seemed to me that one of the gals that was on here about diabetes was, I thought she said that she was an advocate of the every 2 to 3 hour.
Yeah.
Okay. Because she said it all is in portion control.
Right.
And I think that, because I asked her, I said, I have a buddy that says he cannot eat pizza. And she goes, it might be because he can't stop eating pizza. You know, if you have one, you might want the second and third one, like you've been used to all your life.
Exactly.
You know, so I can't remember if that was Brenda that told me that with home health.
Right.
But it was an interesting thing, because I don't, knock on wood, have diabetes. But and another thing that I wanted to ask you too, is it hereditary?
Sometimes diabetes can be hereditary, but there's a whole new opening range of people that have no history of it at all.
Really?
And we're getting it. You know, so now it's what else is in the mechanism that turns it on. A lot of focus is going on autoimmune, just like type 1 is autoimmune. Some aspects of type 2 for some people can be autoimmune. There's other pieces in the puzzle now that we're starting to recognize earlier and say, oh, hey, you know, we kind of, it was out there before, but we weren't quite sure how the puzzle pieces came together. But a lot of it can be no family history at all.
What about chewing gum? Does that have any effect on, would that bother you? Maybe even like bubble gum, which is probably more sugary than...
Well, the funny part on labels for the gum, you know, and you can go down the candy row and just flip the labels over. There's nutrition information. A lot of the gum will say 2 pieces is 2 grams of carbs.
Right.
You know, well, frankly, I eat 1 piece, maybe once a week. You know, now if you're one of the people that can go through 2 or 3 packs of gum in a day, there might be some carbs there to understand. If you just did 3 sets of bubble gum and then check your blood sugar, those are mostly fast sugars in there, so it might have some effect. Or the sugar on the gum, since you just got rid of it and go, oh, let's check my blood sugar. If you don't wash it all off well before you take that blood sugar test, some of that number could be what's left on your hand.
So are you
Really?
saying it's more important to watch carbs than it is calories? I hear you mention carbs quite a bit here.
Most of the time with diabetes, we focus on the carbs. The challenge is you cannot ignore the fat and the calories. You know, carb-wise, we could have 2 things that are equal carbs, but fat-wise, they could be worlds apart. Polar opposites, actually, and be the same calories somewhat, or more. You know, the challenge will be, if you have a higher fat meal, you rack up calories very quick, but your medication and your body needs carbs to walk. You know, without the carbs to supply the muscle with the energy to walk, you run out of steam.
And they're more of a filler, aren't they? Carbs, they fill you up more than...
Some can, some you need a huge amount to fill up. You know, if you're filling up with the non-starchy veggies, the fruit, you're going to eat less. If you're filling up on pasta or rice, you would eat maybe 3 times more than 2 pieces of pizza. You know, it's one of those things of having that balance, you know, starting out with that proteins that fill you up faster, those starchy, non-starchy veggies that will have more fiber.
Yeah.
The starchies and the grains and the pastas save for only 1/4 of that plate.
I was kind of funny that
This is very good. I
the
love this
the
topic.
weight.
Fun is
I
good with
love
an
this
8-inch plate.
topic.
Yeah.
That's the sad part.
That's what they
people
tell you to
figure
get
out.
the littler plate.
Yeah.
I was surprised that rice is not on that they don't want you to have
That's
that.
high. That is high, isn't
But
it?
I always thought rice was what kept you thin.
No, I heard it's high.
Very high.
Yeah.
The sad part is 1/3 of a cup of rice or regular pasta, this little 1/3 cup. You know, and at home, use the measuring cups. You know, these are the
Wait a
best
minute, you're
tool.
saying that's all I could have?
This is
That's it.
15 grams of carbs.
That's it.
So, say, well, and this is one of those times where, you know, most people, a whole cup is going to be 45. So if I'm aiming for 45 grams of carbs at my meal and I just had it all in rice, I don't have room for fruit for dessert now. You know, and hopefully the sauce on my stir-fried vegetables that I'm throwing on top of this rice, it didn't have too much sugar added either. The challenge is that not very many of us stop at a cup.
Yeah.
And because it's a quick carb, it's small. The smaller the pieces, the faster we absorb it, the higher and faster
How long
it
have you
hikes our
had
sugar.
diabetes?
I don't have it yet.
Oh,
I'm
you
in
don't?
pre. And I'm a self-diagnosed pre. It's the nurse in me, you know, when
Yeah.
you kind of say, oh, I have that. In nursing school, every disease you're learning about.
Well,
it's like,
well,
I
you
have
probably have controlled it then, like Chuck asked. You know,
I try very hard to count. I'm asking my patients to do something very hard. Take out the measuring cups. Know where it is. And at least be honest. You know, I was out of town traveling this weekend, so a couple of the meals, I know it was up. So if I step on the scale and it's not where I want it to be, I know.
Right, and
You know,
if you stop and think about it though, when you put something in a full cup, it's a lot. It's
Yeah,
a pretty
it
big
is.
serving once you put it on the plate.
Right.
right. You know, if you just plop on the plate, you don't really see, but you know, that cup will fill the plate. You know, when you're eating out, About a fist. Well, my fist. I'm not quite sure where, sometimes guys' fists, like the last 3 knuckles fill the cup. That's a quick guess, you know. Once again, asking for rice on the side and just scooping in a third of it or a quarter of it. You know, it's all about what your carb count is, but then for some of the new stuff, there was a thing that said like the stir-fried rice, because there's extra oil and meats and things added, that plain rice is better for some people than the stir-fried because of the add, you know, what else you put in it.
I love this topic. Let me ask a controversial question.
Okay.
You're going to a restaurant.
Yep.
And you only have a choice of red meat, say steak, or pasta. What should you choose? If that's the only choice you have. Because you hear bad about both.
Right. There's bad about both, and it's once again portion size. You know, unfortunately, sometimes the only thing they offer you is a 10-ounce steak. That's way too much for me. I'm almost to the point where an 8-ounce steak is too much for me. So I go to the restaurant where I know I can get a 6-ounce. You know.
At home, I only eat probably 4 or 5.
Yeah.
So you would choose the steak over the pasta?
Maybe. Depends what else goes with it. You know, pasta dishes sometimes only come with a salad and bread. You know, of course it comes with garlic bread. You know, you don't need more carb on more carb.
Well, you could have the oil too. You could have oil instead of pasta sauce.
Yeah.
You know, I don't know if that's any different.
Well, every teaspoon of oil, even if it's good oil, is 45 calories, 5 grams.
Is
of
it that
fat.
high?
Yeah. A teaspoon, the tip of your thumb,
Yeah,
is a
phone call
teaspoon.
here, Lori. Hi, you're on the air.
Hi, I wanted to ask her what she thinks about iron counts. Because my iron count is usually low, you know.
Iron count.
Yeah.
And my doctor and the Red Cross nurses keep telling me eat a lot of green stuff, and I do, and it still gets low.
Okay.
So what can I do besides eat a lot of green stuff?
You know, you probably want to talk with your doctor, because there's lots of things that make us low in iron. And women, unfortunately, we do tend to run low in iron.
Because see, they tell me to eat a lot of cereal with at least 100% iron in it. Or more, you know.
Right, but there's also iron tablets, and there's also finding out why you're iron deficient. There, you know, the doctor can run some blood tests to see what kind of problems it is, and it might be more than what food can correct. If you've done it with the meats and the dark green leafies, you know, it's the dark green leafy that's going to add iron, not the iceberg
And I
lemon.
also take a vitamin too to boost up my iron, and it seems to help a little bit, but not a lot.
Yeah, and sometimes if you need to, they make iron tablets, and sometimes that's what people need above and beyond a regular multivitamin.
Oh, okay.
Yeah, so it's if you've done the diet stuff, the exercise, the multivitamin, and you're still running low, it's work with your doctor and have him find out what's going on. It might need a little bit more than the standard, you know, the standard stuff that we start with.
Every time she does the blood work, she does the iron count, and when I go to her, she says it's normal, but you know, when I go to get blood through the Red Cross, they say it's low.
Well, and the Red Cross, for donating blood, you know, you're donating a lot of iron in that blood.
Yeah.
They may have a higher number than what your doctor is looking for in the lab. So for regular not donating blood, you may be safe. And for Red Cross blood donation, they maybe want you a little more middle of the road. And, you know, there's a range that says...
I think it's like a 12.13 or something like that.
Uh-huh.
Or
Okay.
something like that. I don't know for
Yeah.
sure, but that's what they usually tell me.
Okay. Thanks.
And it's
Thank
probably
you.
just that difference, you know.
Okay,
The blood,
thank you.
The blood range is one thing. Red Cross guidelines may be different because you are donating your iron.
This is very interesting, Lori. I appreciate you. Now we went actually 40 minutes without a break.
I can go 3
Did
hours.
we?
Yeah.
We should have been on the whole 3 hours.
Very good, Lori. I'll probably be seeing you soon again. And I'm
Okay.
sure they'll be booking you back. So
Hopefully
we
we'll
appreciate
see
it.
some of your audience at our dinner.
Okay,
All
very
right.
good. Tell
Thank
us
you
again.
for having
Tell
us.
us real quick about that again. It's
May
gonna be-
22nd, give us a call on the RSVP line. It's $20 a plate. 997-6555. It's 4:30 at night for the vendors, 5:30 for supper. It will be a diabetes-friendly menu. Martini's restaurant has been wonderful about what do I want to put on that plate for you guys. And we have options of chicken and steak and a vegetarian dish.
Very good. If you want to leave that, we'll keep announcing for you.
Wonderful, and I put the RSVP lines right there for you.
Okay, excellent.
All right.
Thank you,
Thank
Lori.
you. It's good to see you guys.